Well, you know, many of you may have questions about the coronavirus as the global community continues to raise the alarm over this outbreak.
Yeah, so to help us focus on the facts rather than fear about this virus, we wanted to bring in Dr. John Towns. He's with the School of Medicine at OHSU. Good morning.
Good morning.
We appreciate you coming in to talk with us.
Sure.
I think people have been hearing the term coronavirus. It's been in the headlines.
Yes.
It's being mentioned along with the SARS outbreak we saw in China previously. So what exactly is coronavirus? What are we dealing with in this case?
Coronavirus is one virus in a family of viruses. SARS is one of them. MERS is the other one. That was the severe acute respiratory syndrome virus. It's a family of viruses that's similar to the common cold virus, but it's a little bit different and it has increased severity of illness.
Okay, and so we know that in this case it originated in Wuhan, China. How big of a threat, we think, how big of a threat is it then to us here in the U.S.?
Well, at the moment, we have I think only 12 cases in the United States. There's many, many cases in China, but the public health authorities have been very good at quarantining the people who are asymptomatic but exposed and limiting the spread of isolating the people who have infections. So we haven't seen spread in the United States at all. We haven't, maybe one or two cases of people who infected family members before they got to the hospital, but as far as widespread transmission in the United States, there isn't any yet.
So I know with us being such a global society this day and age, and we do have international travel and flights, I'm sure people are worried, you know, if they're going to the airport, if they're going to be in those places where we're getting international travelers. How concerned should people be right now?
Well, I think, you know, to be concerned about this is to be also concerned about influenza. I mean, influenza is almost as dangerous. In fact, it affects many, many more people than coronavirus does. We have 25 million cases of influenza in the United States right now, and thousands of deaths, 20,000 deaths due to influenza. So if you're worried about anything, it should be that.
The freak out over the Wuhan coronavirus here probably is
and
over.
the way to prevent transmission of coronavirus is the same as preventing influenza. That's wash your hands with soap and water or use an alcohol-based hand sanitizer. Don't touch your face, touch the environment and then touch your face because the virus is transmitted through mucous membranes like in your eye and your mouth. So before eating, wash your hands. Before poking don't rub your nose with your hands. So that's how you inoculate yourself with the virus.
Okay, and speaking of prevention, we've seen the videos from China, everyone walking around with face masks on. Are face masks effective in this case?
Well, face masks are really used best for people who are sick. If you're sick, you can contain the amount of droplets that you spew out if you're wearing a face mask. But as far as preventing you from getting sick, walking around all the time wearing a face mask is probably not going to do much.
Okay, well that's good information to know,
If you're going to have close contact with someone who's ill and coughing, putting on a mask is important for healthcare providers. Putting on a mask as well as eye protection is very, very important.
But bottom line, be more worried about getting the flu at this point than getting the coronavirus in the U.S.
Right, exactly. And the same messages for preventing flu are the same messages for preventing coronavirus.
Okay, some good information to reiterate this morning. Dr. John Towns with the OHSU School of Medicine, thank you so much.
Thank
You're welcome.
you.